Hey everyone, welcome back to the channel. Today we're diving into yeast infections, a topic that affects many but isn't talked about enough. We'll cover the signs, symptoms, and treatment options. We'll break down the science behind these infections in a clear and understandable way, and give you practical tips for prevention and relief. So, grab a cup of tea, get comfy, and let's get started. First things first, what exactly a yeast infection? Let's start with the basics. A yeast infection, also known as candidiasis, happens when there's an overgrowth of a specific type of yeast called Candida. Candida is a natural part of our body's ecosystem, living in places like our mouths, guts, and for many women, the vagina, without causing trouble. But when the balance between bacteria and yeast is disrupted, Candida can multiply rapidly, leading to a yeast infection. Yeast infections can be a real pain, literally. But before we can tackle treatment, it's crucial to know what we're dealing with. The most common type is a vaginal yeast infection. The classic signs include persistent itching and irritation in the vagina and vulva. You might also notice a thick white discharge that's often described as having a cottage cheese-like appearance. There might be a burning sensation during urination or sex, redness, swelling, and general soreness. Yeast infections can also pop up in other parts of the body, like the mouth, thrush, or on the skin, especially in warm, moist areas. In these cases, you might experience redness, itching, and a rash. If you're experiencing any of these symptoms, it's essential to reach out to a healthcare provider for a proper diagnosis. Self-treating can sometimes backfire, so let's make sure we're on the right track. So, what causes these pesky critters to wreak havoc? When something disrupts the balance in our bodies, it creates the perfect opportunity for yeast to spiral out of control. Antibiotics can wipe out the good bacteria that keep yeast in check. Hormonal changes, like those during pregnancy, menstrual cycles, or menopause, can create an environment where yeast thrives. Diets high in sugar and refined carbohydrates can fuel yeast overgrowth. A weakened immune system can also make you more susceptible to yeast infections. Wearing tight, non-breathable clothing can trap moisture and heat, creating a breeding ground for yeast. Staying in wet clothes for extended periods can also increase your risk. Chronic stress can mess with our delicate bacterial balance, making us more vulnerable to infections. Okay, let's talk solutions. The good news is, most yeast infections are very treatable. Over-the-counter antifungal creams, ointments, or suppositories are the first line of defense. If your symptoms are more severe, your doctor might prescribe an oral antifungal medication, such as fluconazole. Some people prefer natural remedies like probiotics, which can help restore a healthy balance of microorganisms. Plain, unsweetened yogurt contains naturally occurring probiotics and can be applied topically or eaten. However, the evidence supporting the effectiveness of probiotics for yeast infections is still mixed. If it's your first time experiencing symptoms, it's crucial to see a healthcare provider to get a proper diagnosis. There are other conditions that can mimic the symptoms of a yeast infection, so self-treating without knowing for sure can sometimes do more harm than good. An ounce of prevention is worth a pound of cure. There are plenty of things you can do to reduce your risk of yeast infections. Stick to breathable cotton underwear and avoid tight-fitting clothes for extended periods. Change out of wet swimsuits, sweaty workout gear, or damp clothes as soon as possible. Limit your intake of sugar and refined carbohydrates. Incorporate probiotics into your diet through fermented foods or supplements. While it's important to keep things clean, avoid douching as it disrupts the natural balance of bacteria in the vagina. Focus on incorporating plenty of fresh fruits, vegetables, whole grains, and lean protein into your diet. Probiotics can help maintain a healthy balance of microorganisms, making it harder for yeast to take over. While most yeast infections can be managed with over-the-counter treatments, there are situations where it's essential to seek professional medical advice. If you're experiencing symptoms for the first time, see a doctor to confirm the diagnosis. If over-the-counter treatments haven't worked, reach out to your doctor for a more tailored treatment plan. Recurring yeast infections warrant medical attention to identify any underlying factors. If you're pregnant, consult with your healthcare provider before starting any treatment. If you have a weakened immune system, consult with your doctor if you suspect a yeast infection. Alright, that's everything you need to know about yeast infections, from signs and symptoms to treatment and prevention. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who might need it. Thanks for watching, and I'll see you in the next video. Take care of yourself and stay healthy. Bye for now.